Do you have to take a vitamin D supplement to be healthy? Well, you do have to have good, healthy vitamin D levels in your blood to be healthy. How you get there, yeah, you might need a supplement, but we're actually designed to make vitamin D from the sun. The problem is that most of us are not doing that. You've got to be outside 15 to 20 minutes, 3 to 4 times a week with your face and skin on your arms exposed, and that's without sunscreen. If you have darker skin, you might not be making as much because the melanin in your skin acts as a natural sunscreen. If you're older, the skin thins as you get older, and you don't have as much of that chemical, that naturally present chemical in the skin that turns into vitamin D. So a lot of us aren't making enough from the sun. What about foods? Well, foods are actually pretty low in vitamin D. There's some in fatty fish, a very little amount in egg yolks, and then of course fortified foods like calcium and vitamin D added orange juice. Milks, whether it's cow's milk or plant milks, are often fortified with D, but they've only got about 100 IUs in a serving. And you know how much vitamin D we need every day? It's probably around 1,000 IUs or international units. So many of us need supplements. If you have pretty healthy vitamin D levels already and you want to just keep them there, you need about 1,000 IUs a day. If your vitamin D levels are low, you might need up to 4,000 to 5,000 IUs a day just until you get them up to the healthy levels. Then you'd want to back down to not too much more than 1,000 to 2,000 IUs a day. Because too much vitamin D, those blood levels get too high. Not good. Could increase the risk of kidney stones because you might start to actually overabsorb calcium, and there might be a risk of some cancers. So as with everything in nutrition, we're going for that Goldilocks spot, that spot in the middle where we're getting the right amount, not too much, and not too little. Why do you even need to have vitamin D? Well, vitamin D is important for your bone health. It helps you to absorb your calcium. It also helps with muscle strength and some other things as well, such as resistance to infection. Yes, it might help us to ward off COVID-19, but the studies so far only show that there's a modest link between having adequate vitamin D levels and a lower risk of infection. It's not a guarantee, and the studies do not show cause and effect, just this sort of correlation. But why not give yourself that edge with getting the right amount of vitamin D every day?